Hi, I'm Rachel Meliotis, a senior editor with O'Reilly Media, and I am here at Strata RX with Aneesh Chopra, and he is a senior advisor at the advisory board company and on the advisory board of Apogee, and you are also the first CTO of the United States.
Yes, nice to see you. Thanks for having me.
No problem. So you've done quite a bit of work in both the public and private sectors, concerning both health and technology. Can you share a little bit about the challenges and the similarities that you've seen in both areas?
Well, the opportunities are exciting in both areas, and so let me just give you sort of my thumbnail sketch.
Sure.
If you take a look at the successes we've had in the tech industry, Moore's Law and all of the related improvements that we've seen year over year, productivity gains might be the better way of describing it, that's been a phenomenal story for the American economy. If you took the same question on healthcare, have we seen the same level of productivity gains in the health sector? The answer is we haven't. And by most estimates, one of the most easiest paths to improving productivity is to inject data-driven decision-making into the organization. McKinsey did a study on this. There's a whole bunch of people that have commented on it. So I think the biggest challenge is to take what we've learned that works in tech and productivity economy and to apply it in healthcare. And it's starting to happen, and it's really exciting. That's why now it's better to be an entrepreneur and innovator in healthcare than almost any other sector of the American economy.
So do you think you think there's opportunities in both sectors, or do you think one has more of an impact?
Well, for tech, the health industry at 20% of GDP is just too big a market not to have on your balance sheet, if you will.
Yep.
And for the healthcare sector, to not fully harness the full power of technology and data and innovation is leaving too much on the table.
Right.
So it's the perfect opportunity between the Affordable Care Act and the High-Tech Act to really bring these two forces together. You combine the creativity and the entrepreneurial spirit of the American people with the new incentives and the opportunities that are available, combined with this movement towards openness and data, and you've got a formula for success.
I totally agree. So most people would agree that open data sets make more sense. What is the government doing to sort of help insurance companies and providers and other health companies open up, encourage them to open up?
You know, one of my favorite experiences in the administration was the bully pulpit side of the executive branch, the convening power of government. I often call this government with a lowercase g. The president did this a lot with his call to action, his executive action activity, where Congress, has already kind of granted authority, or if we twisted a couple of things in a manner that was consistent with the rules and the law, there's no reason why we couldn't choose to open up data. It may not have been something that had been done in the past, but it had been something that we had the authority to do. So by leading by example, we have created the conditions for a number of folks in the private sector to follow. Blue Button is clearly the best case study because it was the private sector who helped advise the government on the idea of a Blue Button. Adam Bosworth,
so explain what the Blue Button is.
Well, it was very exciting. Markle Foundation convened a meeting several years back, and I couldn't go, but Todd Park, the CTO at HHS, Peter Levin, the CTO at the VA, and a number of other stakeholders convened to discuss opening up data for patients. And it was a broader discussion about the Meaningful Use Initiative and a whole series of other policy goals. And Adam raised the question. Adam invented XML and, entrepreneur, phenomenal guy, was at Google and Microsoft, said, look, why can't there be a blue button that patients could touch so that they could accept in electronic form, machine-readable form, their own data? And birthed from that meeting was a commitment by Peter Levin that the VA would get cracking on whether its million veterans that are on My Healthy Vet could have a service like this available to them. Months go by, and I get the word from Peter that we're a technical go, but we got to make sure that the organization's ready for it. So, long story short, President Obama in August of 2010 gives a speech to the disabled veterans of America and says, veterans, this fall you're going to have a blue button, and you're going to have the ability to download your own healthcare records safely and securely. 90 days later, Blue Button was launched, and now we're over 1 million veterans have used it, and because of it, the private sector, United, Aetna, and a whole host of other data holders have publicly pledged to follow suit and make Blue Button not a noun, it's not a thing, into a verb, that we're going to make it easier for folks to have access to their own data. Not only did that inspire the private sector in healthcare, It actually spilt over into education and energy. There's now a green button and a My Data button and soon to be a gold button and all the rest, because the theory is act from a position where you're going to do it for your own leader in a leadership capacity, and then you convene to compel the private sector to follow suit. And I think the consumer-mediated model of data exchange will be a reality because of this convening power of government.
That's really great. I'm happy to hear that it's sort of spread from where it started. So I was reading up on you, of course, getting ready, and you recently said that APIs, you think, are going to be the key to making government more accessible.
Yes.
Tell me a little bit more about what you're thinking there.
So one of the first assignments the president had given me was to find ways to use technology and innovation to make the government work better. And I cast a pretty wide net to study what was working in the industry. And one of the things that I was very keen to understand was sort of this platform economy and the power of APIs, whether it be the Facebook economy, the Twitter economy, and a whole range of other stakeholders, to say, look, let's find ways to extend the core of the organization. So essentially off-balance sheet financing, let's get others to do the work. So the moment that hit me the most was when the president had invited Sheryl Sandberg to serve on the Jobs Council. And Steve Case and Sheryl and John Doerr, I was on a panel in Silicon Valley. It was the summer months of 2010, 2011. And Sheryl made the comment, at the time I believe she had 3,000 employees on Facebook payroll. But when she queried one of the online job boards, there were 30,000 jobs associated with Facebook developer. A force multiplier. And so the question that I posed back in the administration was, if we're 3 million Americans working for the government, and we have 300 million Americans overall, how might we make it easier for the 297 million Americans to support and extend the value that the 3 million hardworking Americans were doing on behalf of our government? And to do that effectively, you need to have a bit of an interface, hopefully standardized, and APIs are a key factor. You'll see that in the healthcare.gov storyline, as it evolves to become the marketplace for the country, you will see evolving the idea of APIs front and center, because there should be lots of ways to access the information so that consumers have really no wrong door in connecting to the services that are right for them.
That's awesome. Well, as a citizen, I thank you for that. Thanks for joining me today.
I wouldn't say me. I would say I thank the entire administration. So great. Thank you.
Thanks for being here.
Have a great day.